The space is, I don't know, 2 or 3 times the size of the old space, which is nice. So everyone's first impression was just like, wow, this place is huge. Yeah, but everyone's got their own bathroom, everyone's got their own bedroom. So everyone's got more privacy. Just the space itself, you can tell it's a modern hospital design, right? It's bigger, brighter, more open, more windows. We even have this amazing courtyard that patients have access to that is beautiful. You know, it's such a respectful space, and patients have commented on that, of just how nice it is. It makes them feel important to be in a nice space.
This kitchen, it's a lot bigger, so we're not jumping on top of each other, which we just came from. And I think it's a lot better food-wise for the patients. And so a lot more space means a lot more items that we can bring in, a lot more choices that people can have.
I think being over in the new tower has been great for our patients. They mostly all have their own rooms. The rooms are big, bright, spacious, with big windows and lots of room for wheelchairs and any other equipment we might need to give a patient, which is great for an OT perspective. The other thing I love about being in the new tower is that there's an outdoor terrace space accessible on every level, so we can get the patients outside enjoying the sunshine and fresh air.
One thing I really enjoy about the new tower is the size of the hallways. It's a lot easier to help patients with physiotherapy and walking, because you can do multiple patients at the same time, and there's lots of room for traffic.
It was like basically going from the 1970s to through 2020 in like one day. So it was a huge technologically leap from our team. Our patient entertainment system is now state of the art. We have all those different systems that we didn't have in our legacy and in our 99 building or over at Garden Street to that fact.
So you even experience in the new tower a little bit of a shift in things like internet connectivity. You have this ability to access through your guest Wi-Fi, your own personal services. We've also tried to introduce a bit more virtual care. We see that it works much more quickly and it's more readily accessible throughout the building, but especially in the new tower. So we've been using those kinds of tools to be able to help connect patients to families and loved ones over the course of the pandemic when they're experiencing isolation.
Oh, this is really something. Like, you know, these rooms are really very nice and bright and big, you know, and like, you know, the way they've set it up with, you know, the bathroom and, you know, going in the shower, you know, the whole thing about it is fantastic. They've pretty much thought of everything here.
On behalf of our staff, physicians, and volunteers, thank you to everyone who helped make our expansion to Donald B. Green Tower a reality. This new space was made possible through investments by the Province of Ontario, municipal partners, and of our generous donors from across the community. Thank you to our many staff and physicians who ensured a safe move for our first patients in the tower. 1 year ago, we dedicated the move to you. The smiles on our first 40 patients in the tower were proof that months of planning and hard work has paid off. In the 12 months since the momentous day, in your honor, our teams have worked hard to provide the best patient experience to all our patients. The Donald B. Green Tower provides our healthcare workers with modern healthcare tools they need for our community today and into the future. This tower is our promise to continue to invest in the tools and technologies that healthcare workers need to deliver the best patient care right here in Leeds Grenville. If you're interested in learning more or how you could join our team, our growing and thriving team, please visit www.brockvillegeneralhospital.ca.